Hello, my name is Christian Gardner, and I have with me Mr. Ed Cambrick. And today we're going to do a elbow evaluation. Mr. Cambrick, do I have permission to record this simulated evaluation of the elbow and forearm for my exam and diagnosis 2 class?
Yes.
Okay, and you can give any type of age. So, what is your age?
Old.
Old. Okay, and what happened to your elbow?
I was swinging the golf club and now it hurts.
Okay, gotcha, gotcha. And do you have any previous injuries before this injury? Like any previous
No.
upper extremity? No. And did this ever happen to the other arm?
No.
No. Okay. And also, from a scale of 1 to 10, did you ever like 1 to 10, one being a 10 being like wow, this really hurts? What's your pain scale?
At its worst it's 7, but on a daily basis 3.
Okay, gotcha. And also, is there any type of current or previous uh, injuries that you had in the extremities, upper extremities?
No.
Okay. And do you take any type of medications?
On occasion I'll take some Advil, ibuprofen for it.
And do you have any allergies or medical health conditions or family genetic diseases?
No.
Okay. And when does it hurt? Like when you're swinging a golf or when you're moving your elbow or
On daily living it does not bother me, but being active, playing golf, it kills me.
and what are your goals in recovery from this injury?
To be back on the golf course pain free.
Gotcha. And also, one thing other than golf, are there any other activities that you participate in?
No, not that bothers the elbow.
But and then observation, I will go ahead and observe the non-affected elbow first, seeing for any swelling, redness, any deformities, and then I'll check the range of motion of the uh, non-affected elbow. Can you flex, extend? There you go. And then I'll do the exact same thing with the affected elbow. So looking for swelling, there's a little bit of swelling. There's some redness there and no deformities other than the swelling. Can you flex? There's a limited of flexion and then extend, a limited of extension as well on the observation. Also, I look at the gait over here on this side, seeing make sure his posture on the both elbows is the same. Here seems very relaxed and straight. Here a little bit of uh guarding, and then I'll move on to palpation. Do I have consent to palpate? And then right over here, I'll palpate the non-affected arm first. I'll just go ahead and see any type of swelling there. No. Check for any deformities, and then go ahead and I'll also make sure that I'm checking proximal too before checking the area. Proximal and distal. This will be proximal. This will be distal. Make sure any fractures. Check for any fracture, tenderness, open wounds, swelling. Feel for skin temperature. Checking the normal. And then I'll go ahead and go over to the affected elbow. And then I'll go ahead and check distal, making sure there's any deformities on the radius. Checking the proximal, just asking the patient, is there any type of pain or going on through
No.
here? No? Okay. As I get closer,
Starts to get irritated.
start to get irritated. checking the swellness. It's swole, and checking to make sure there's any type of fractures there, no open wounds. So just swelling. Is there any little tenderness when I palpate here around this area?
Left hand bother with your left where you're palpating with your left hand bother.
Well, it's right here.
Yes.
And then afterwards, while I palpate, I will actually see, check for any type of circulation, making sure that the brachial artery, the ulnar artery, is supplying enough blood to the hand, making sure all that swellness then swole area is not affecting the circulation of the limb. And then afterwards, I'll go ahead and go to my special test. So for I'll demonstrate on the non-effective arm and explain to the patient what I'm going to do. So here I'm going to take you to passive range of motion, reflection and extension, and then take you to valgus, varus, and it seemed pretty normal, seemed pretty good. And then I'll move on to manual strength testing. So I'll have the patient go into flexion, and then he'll push my hand to extension, pretty good muscle strength. And then I'll have him go back up in flexion, pretty good muscle strength. And then also just neurological testing, just seeing that if he has sensation, can you feel it? Well, say, can you feel that? But just seeing that if he can. And then also seeing uh, the radial artery, because we're checking the radial nerve, the median nerve, and the ulnar nerve. Can be affected by this swollen area over on the affected side. So I'll go ahead and transition back over here, and we'll do the same thing, just the passive range of motion, seeing where he can stop it, and then go ahead and stand, seeing where he can stop it, and then we go ahead and do valgus, seeing if there's any like elasticity in the area. A little bit more valgus there, and we'll go ahead and do the manual strength testing, full strength. Okay, and as I observe, I see like a little flexion. It's a little bit of loss of strength there in the flexion area, and then I'll just go ahead and do the neurological screen, seeing if any sensation. Just do it, right? And then after that, um, really honestly, I can just refer if I need further special testing. I will refer them out to an X-ray or MRI, and with acute care plan, I will ice the swollen area for about 15 minutes, 3 times a day, and also may give the patient a ACE wrap just to kind of compress the area to limit the swelling to get that swelling and inflammation out of the area. And also, I might also, if he's planning to return back to play on the golf course, I might supply the patient with a compression sleeve as well. And just for additional modality treatments, we can apply heat application from using a stem machine, hot pads, or ultrasound, just to kind of get most of that inflammation and swellingness out the area. And also can be used for a pain control. Uh, and we can supply him with non steroid inflammation medicine as well, like Tylenol. And I'll advise the patient to also just give rest the elbow, but also do active range of motion as well, just to make sure the elbow don't stiffen up or just stay locked in place. Kind of want to keep the range of motion and prevent stiffness and arthritis. And also, if the patient still has liquid or fluid in the area, if it's still fluid present in the area, I would advise the patient refer the patient to a physician, so that way the physician can check if there's um, any type of infection in the area. Uh, Here, if there was an infection in the area, cortisone will be, or a steroid injection will be in use. Um, Also, if they just want to pull out the fluids, the excess fluids, then they will go ahead and use a needle aspiration to extract the fluid out of the area. And then just for social determination of health, um, usually I would ask in the history about like the person's education, at which clearly Mr. Cambridge is graduated. He is not indeed any education, correct? Okay. And also just I'll ask about kind of like is he insured any in health insurance, and also social community. How's his social? Like, do you have family, friends that can transport you places? Because with having a Olecranon bursitis, you can't really hardly kind of drive just a little bit. You can drive with one hand, but with the other hand, you can't really function as well with flexion and extension. And neighborhood wise, where I'll ask him like what neighborhood he lives in. Does he live close to the facility or not? And also with economic stability, I would, based off of his answer of the where he lives at, I'll kind of just make that educated guess. And the patient reported outcome measure that I would use is the Oxford Elbow Score, just to kind of give the patient more more possession of the evaluation, kind of explaining to me like how does he feel every single day, how's the treatment going, is the treatment working for him, does he experience any type of pain. It just gives him more of a power in the feedback and letting me know like how's his recovery status is doing. And then the ICF model, with the health condition, I diagnosed it as olecranon bursitis. And the body structures that involve olecranon bursitis is the olecranon bursa, and also the skin and the ulna. Activities, he said that he plays golf. Participation, uh, he might can go out and watch his friends or his colleagues play a little golf while he's recovering. I mean, we can supply him with a compression sleeve so that way he can kind of maybe not hit a what in golf. How many holes are in golf? 18. So maybe lowering it down to maybe 8 holes, and so that or 10 holes. I really don't understand golf, so just is that an option to
Yeah,
yeah,
play
so
9 holes,
nine
half
holes,
half 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 course.
half yeah. So you can play half the course. Kind of still he's still giving him that ability because he still wants to go out there. His main goal is to go out there and play. So you don't want to take that away from him. You still want him to go out there and enjoy his time, enjoy his activities. Just kind of limit him from going from 18 holes, maybe just go ahead and just play half and just play 9 holes. And environmental factors would just be his like his family, his social, like he seemed very dedicated. So he'll want to get back out there on the golf course. And then personal factors would just be like his age, any type of health conditions that he might have, or family medical history. And that's about it. Do you have any questions?
No, sir.
Okay, and I thank you for letting me do this, and thank you.